What I'm going to do now is I'm going to switch to a section called Myths versus Facts. And this is something that I've debuted on the show for many, many, many months now. And really it's about setting the record straight. You know, at the beginning I talked about how it's important to build trust and deliver truth. And I really want to set the record straight when it comes to medical assistance. So here we go. How it's going to work, I'm going to say a statement, and then whoever I pick on, yes, will give me a yes, or they will say, they'll say either myth or fact. And they will tell us why. It's going to be kind of rapid fire, a little back and forth kind of thing. We're going to get through as many of these as we can with some of the time that we have left. But again, I want to do myths versus facts, marvelous medical assistance. So here's the statement. Liz Hernandez, here we go. First statement, myth or fact. A medical assistant is the same as a nurse.
Myth.
And can you give a little commentary?
False.
Yeah, myth, yeah. False myth, same thing. Triple myth.
No, I mean, nurses have far more training. They have more schooling. They're very knowledgeable. I respect all my nurses in our office. They're people I can always come and talk to if I have any questions. So, no, medical assistants, we help out a lot with the physicians and the nurses. But definitely my heads go off for the nurses. They are wonderful. They have a lot more training and are skilled in various areas.
All right, here we go. Liz Harkins, myth or fact? Here we go. Medical assistants are simply paper pushers.
Oh, that's a myth.
That's a triple myth?
Yes. No, we are so much more. There are so many things that medical assistants do. I mean, yes, we do push paper, but we answer and triage phone calls. We assist with procedures. In some offices they do phlebotomy. There's all kinds of things that medical assistants do, and in so many variety of areas. I mean, our medical assistants, help create our entire medical record system. I mean, and our, electronic record keeping and all of that stuff. I mean, it's incredible some of the things that they've done. So.
Excellent. Here we go. Cassidi Hope, myth or fact? Medical assistants can work in a wide range of healthcare settings.
That is a fact.
All right. Double fact, triple fact?
That's triple fact.
Triple fact. There
Yeah.
you go. Excellent. That is definitely a fact. Please explain.
Yeah, so we can work in hospital settings. We can work in OB's office, dermatology, plastic surgery. I mean, there's no real field that we couldn't work in. As long as, we're willing to put the effort into learning, how that doctor or that type of practice works and, their role there.
Excellent. Here we go. Next statement here, Liz Hernandez. Here we go. The market for medical assistance is declining.
Oh,
What's your
false.
thoughts?
No,
Myth?
I think it's a myth. I think we need medical assistance, I think, more than ever. Especially since there's a lot of new clinics coming out, different departments. I think medical assistance is a growing career if you really want to pursue it, if you like working with people, if you enjoy working with people, working with providers, with doctors, helping. It's a great field to get into, and it's growing. And
there's no doubt about that. I will echo that. Here's a statistic from the U.S. Bureau of Labor Statistics, the job outlook for medical assistants from the years 2016 through 2026. It is projected at a 29% growth that equals 183,000 plus new jobs during this time frame. So it's hot to get into medical assistance because the job demand is there without a doubt, and it's going to continue to grow. So consider that if you're out there. Here we go. Next statement, myth or fact. Liz Harkins, here we go. Here's a statement. Being a medical assistant and being a certified nursing assistant are two different things.
That's a fact. That is a fact. They are different. Whereas we talked about previously, being a medical assistant, you can be a registered or an unregistered medical assistant versus a certified nursing assistant. You actually do have to go to schooling and get a certificate for that.
Excellent. Here we go. Cassidi Hope. Next statement. Myth or fact? Here's a statement. Anyone can be a medical assistant with little on-the-job training.
I'm going to say that is a fact. And the only reason I'm saying that is because I've actually witnessed somebody coming off the street and them actually training them to be a medical assistant, and then they ended up going to be certified. So I totally think that is a.
Fair enough. I think there's that's a, by the way, that's a tricky one, and I threw that out there on purpose. I think it could go both ways. There's no doubt that if somebody has the passion to want to do something and they work hard at that and have a strong work ethic and pass the certifications, absolutely somebody can learn how to be a medical assistant and go from one career to a medical assistant career. And we talked earlier that there is a lot of on the job training as we continue to cultivate our skills as well too. Excellent. Here we go. Myth or fact. We'll do a couple more of these. Here we go. Liz Hernandez. Here's a statement. When I visit the clinic, the person that helps me is a nurse.
If you're seeing the provider, you're most likely going to see the medical assistant, which is me. So a lot of the times, I know when I bring the patient back, they say, "Oh, are you the nurse?" I'm like, "No, my name's Elizabeth. I'm the certified medical assistant." And so you given, but most of the time they think that you are the nurse. But no, we are the medical assistants, and we're the ones that are rooming back. Usually at our clinic, the nurses will do the triaging. Or some nurse visits, but mainly when you're seeing the medical assistant.
All right, here we go. We got one more of these. Here we go. Liz Harkins, here we go. Here's a statement. A medical assistant must work under the direction of a nurse. What's your thoughts, myth or fact?
Either a nurse or a physician, so, yes.
Very well. We'll call that a fact. And there's no doubt that, oh wait, I should let you explain. Or I'll wait. All right, here, I'll take one for the team. Here we go. There's no doubt that from a physician standpoint, yes, we have our medical assistants that are tasked to work under us, but there's no doubt that even some of the protocols that we do in the office, a nurse can educate the medical assistant on how to do a certain protocol, or sometimes a nurse may have to actually administer the protocol. So there's a little bit of a hierarchy there. There's no doubt about that. But again, we're all making sure that we do our jobs and we're practicing within the scope of our practice. So we have,
Can I also
please
say
go
something?
ahead.
What I also want to say about that too is that with patients, I might think I know something about that. I might think I know something about their condition. I may have a lot of experience with what they're going through or that test. But the truth is that the doctor or the nurse is going to know how to go through that patient's history and really take a look at their chart and say, okay, yeah, that may be typical in most cases, but in this particular patient's case, they need this or this or this instead. So it is important that it is under the direction of a nurse or a physician.
That is correct. Excellent. So we got about 5 minutes left.